Man's valorous search for a remedy of cancer has yielded a steady success over the years. Through tenacious efforts, we have arrived at a point when a reasonably good cure and relief can be offered to the million sufferers of the dreaded disease. During the last 100 years or so, following discovery of X-radiation, radiotherapy has evolved into one of the important branches of medicine and has established its role as primary modality in cancer treatment. The achievement and growth of radiotherapy, particularly during the last 2 or 3 decades, was made feasible by development of super voltage and sophisticated therapy units, ability of dose measurement more precisely, execution of accurate treatment, and of course, availability of trained medical and technical personnel. The cancers which are highly curable to radiotherapy, like those of mouth cavity and female genital cancers, constitute about 50% of all cancer patients in India. This situation necessitates adequate development of radiotherapeutic facilities in our country. Here the patients receive treatment of varying qualities, which is mainly due to the use of outdated technology in the delivery of radiation therapy. We asked Professor B.D. Gupta regarding the impact of new technical development in the field of radiotherapy.
You see, in order to achieve better cure rates, high doses of radiation must be given to the tumor volume, but the surrounding normal tissues should get minimum clinical dose. And you can achieve this goal only with high intensity radiation available from super voltage machines. Super voltage radiotherapy, especially with linear accelerator, greatly improves the overall cure and survival of cancer patients.
With super voltage radiotherapy, there has been a revolution in the management of cancer treatment. 5-year survival has considerably been increased in Hodgkin's disease, seminoma of testis, cancer of the cervix, cancer of the prostate, and cancer of the ovary.
So to cure cancer, we need high technology to develop super voltage machines like linear accelerator.
In linear accelerator, radio waves are generated in pulses from magnetron These waves then pass through a waveguide to reach the accelerator tube, where electrons from a filament are injected into. These electrons, carried along the radio waves, are accelerated and ultimately hit the target to produce the megavoltage radiation beam. At present, radiotherapy centers in our country are mostly working with cobalt-60 units with average beam energy of 1.25 MeV. With use of linear accelerator, beam energy much higher than that of cobalt units can be produced. The other definitive advantages are: linear accelerator saves the skin and subcutaneous tissues more efficiently.
Because with 4 MV linear accelerator, the maximum buildup is 10 to 13.5 millimeter below the skin, as compared to 5 millimeter in case of cobalt-60. There are three distinct advantages in this: in delivering dose in face and neck areas, for treating of larger fields as in Hodgkin disease, and for delivering booster doses.
Linear accelerator has greater penetrability. At 10 centimeter depth, the dose is about 10% higher than that of cobalt-60 units. Another advantage is linear accelerator has no problem of electron contamination. And linear accelerator does not house any radioactive source. So, the replacement and disposal of source as needed in cobalt units are not required for the use of linear accelerator.
If all the 700 radiotherapy units that has been recommended as immediate minimum need for our country are installed as cobalt-60 machines, then almost 100 of these radioactive sources have to be replaced every year. This would cause unnecessary radiation burden and overtaxation on the isotope disposal facilities at Bhava Atomic Research Center, Bombay. After considering the advantages and need for radiotherapy equipments, linear accelerator must be developed indigenously. This should be taken up on priority basis.
The program of developing a 4 MeV linear accelerator was launched with the collaboration of 3 organizations: the Postgraduate Institute of Medical Education and Research, Chandigarh, provided the infrastructural facilities and supplied the specifications and requirements necessary for undertaking the project.
I would like to congratulate the scientists of 3 organizations, that is Samir of Tata Institute of Fundamental Research, Bombay, Central Scientific Instrument Organization, Chandigarh, and PGI Chandigarh, for working as a team to develop the indigenous linear accelerator that has been installed in PGI. This accelerator is now actively being utilized, and nearly 50 patients every day are being treated with the help of this facility. I may also emphasize that this facility has improved the treatment of cancer patients tremendously. With the conventional X-ray therapy or with cobalt therapy that came in between, the present day linear accelerator can give 2 to 3 times better results and long-term survival of patients treated for cancer with this facility. Our facility for linear accelerator is not the only one, but PGI has actively tried in the last few years to update its facilities in all technology, whether it is related to cardiology, neurology, neurosurgery or ophthalmology. I might say that in cardiology now there are facilities for non-invasive investigations by echocardiography, treadmill test or by gamma camera nuclear studies or cineangiography. In the neurology, there are facilities for first-rate investigations of all types of problems, including very sophisticated studies of the arteries supplying the brain. Neurosurgery department has laser facilities to treat their patients. Recently, in eye department, laser facility has been installed for treating patients with vitreoretinal disease. I think the progress, if maintained, would give a new flip to the patients that come to the portals of PGI for treatment with new technology.
The other organization which participated in this joint program is the Central Scientific Instrument Organization, Chandigarh.
CSIO is a premier institute devoted for the development of instrumentation. It has various disciplines, including the medical instrumentation. Recently, we took review of our activities and decided to put special thrust in the field of medical instrumentation, and we undertook a program of developing high-tech linear accelerator for treatment of cancer patients. This was a program which was undertaken in collaboration with two other institutes. The objective of the program is to complete a high-tech linear accelerator in a short period as 30 months. We are very happy that we have completed this project within the stipulated period. It was originally conceived to be 4 billion volts linear accelerator, and now we are very proud to say that it achieves more than 5 million volts. It has also started treating cancer patients. It is hoped that this technology will be transferred to industry, where more than 5 to 10 machines would be produced annually.
The Society for Applied Microwave Electronics Engineering and Research, Bombay, that had earlier developed an industrial linear accelerator, provided the technology and expertise available with them.
Samir had infrastructural facilities in microwave electronics and engineering for developing accelerator tubes. This was earlier nurtured and utilized in the space research work in our country. With this technology and know-how, we were in a position to develop a medical linear accelerator as well.
The project was funded by the Department of Electronics, Government of India, as a special project to develop high technology in cancer treatment.
Department of Electronics is the executive wing of the Government of India with a primary function of development of electronics in the country. We also have a regulatory role, that of resource allocation. The selection of the linear accelerator machine, also popularly known as LINAC, was done with two principal objectives. The first is the challenges that it poses before our scientists, and second, that its use in mass electronic healthcare for cancer therapy. At this juncture, I would like to record my appreciation and gratitude to the three institutes that took part in this project: PGI at Chandigarh, CSIO at Chandigarh, and Samir at Bombay. All have played their parts in the successful completion of this project. I would also like to mention that we are going to commercialize this technology through 5 leading public sector institutions of the country.
So, after days of painstaking endeavor, the project has ultimately become a reality. Jeevan Jyoti, a 4 MeV linear accelerator, has been installed at the Radiotherapy Department of PGI, Chandigarh.
Actually, it is a matter of great national pride for our successful efforts toward self-reliance and manpower development program in this highly technical area.
With the development of linear accelerator Jeevan Jyoti, India's journey in the field of high-tech medical engineering has just begun. And here too, the success has been heartening indeed.